Hello everyone, this is Amit Budua from RGKar Medical College, Kolkata. So welcome to my channel.
Small incision cataract surgery. First, see the principles of cataract surgery. 1. It is a form of extracapsular cataract surgery. 2. It involves creation of self-sealing entry wound. 3. Here, in the bag, posterior chamber IOL placement is done. Operation is done from the head end of the patient. So here the superior portion of the eye is placed towards your side or in the inferior side of the screen. Now see the anesthesia given to patient. For children general anesthesia is used. And for adult parabulbar block is being given. It is injected in the inferior and the superior portion of peripheral orbital space. The agents used in parabulbar block are 2% lignocaine, 0.5 to 0.75% bupivacaine, 5 international unit hyaluronidase, and 0.1 in 1 LAKH adrenaline. Now come to see the steps of small incision cataract surgery. At first, draping is being done. Superior recluse bridal suture is being done to fix the globe and down gaze for maintaining the counter traction force during the delivery of the nucleus. Peritomy and scleral exposure is being done, tenons and conjunctiva dissected from 10 to 12 o'clock position. Then the sclerocorneal tunnel is being made. At first, 1/3 to half thickness of scleral incision is being made. See the course of the incision. Secondly, sclerocorneal plane is to be extended almost 1 to 1.5 mm into clear cornea, and finally tunnel is extended up to anterior chamber by internal corneal incision by using keratome. Then at 9 o'clock position a valvular stab is being made on clear cornea by side port. This is made to infect trypan blue for staining the nucleus, which is done just after making the side port. Also anterior capsulotomy, cortical wash, and for dilating IOL into the capsular bag is also done by using the side port. Now the anterior capsulotomy is done. There are 3 types of capsulotomy techniques present. First, come to the envelope or linear technique. In that technique, linear cut is being made like this. Nucleus is taken out and then completion of the capsulotomy is done. There is another technique called kin opener technique where the iris margin is taken as reference, just like edge of kin is taken as reference in kin opening. And finally the continuous curvilinear capsulorhexis where continuous cut is made to tear anterior capsule in a circular fashion. Hydro procedures like hydrodissection or hydrodelineation is done by injecting BSS solution to separate cortical mass from capsule or to separate nucleus from epinuclear plate. The nuclear prolapse is completed by Sinski hook dialer, thus the nucleus comes into anterior chamber, then the nucleus is taken out from the anterior chamber through sclerocorneal tunnel. This procedure can be done by wire vectis, Thaco sandwich technique, fishhook technique, Blumenthal's technique, Visco prolapse or Thaco fracture technique. Aspiration of the cortical material is done by the Simcoe's byway irrigation aspiration cannula through side port. Fluid is given through irrigation port and the whole matter is aspirated via another port. Finally the IOL is inserted via the sclerocorneal tunnel by MC Ferson's forceps and dialed into the capsular bag by Sinski's hook or dealer. Now the anterior chamber is maintained by viscoelastic substances. Then the viscoelastic material is washed thoroughly to prevent secondary glaucoma, and at the end, after maintaining the anterior chamber with BSS, the wound is closed, and the conjunctival flap is repositioned.